From the News Channel 5 Network, this is Morning Line with Nick Beres.
Good morning, everyone. Thanks for joining us on Morning Line. I am Nick Beres. It's good to have you with us on this Wednesday. We're going to be talking medical malpractice this morning. Invite you, as always, to join in the conversation. We do this show every month, and it's a chance to not only learn, I think it's a fascinating field of law, but also maybe call in if you have a situation where you think maybe things didn't go as well as you thought with a doctor, a treatment, a surgery. Medical malpractice, it's important to be aware of what your rights are and how you respond if you think things didn't go well. And we've got, in my opinion, one of the very best medical malpractice attorneys in the entire state. Dare I say the country, Clint Kelly. He is. That's all you do is medical malpractice. I can't come to you for a divorce, can I? Not that I'm getting divorced. I can't come to you to represent me if I'm accused of a crime, can I?
I'm not board certified in criminal law, and I'm not board certified in divorce law, but I am board certified in medical malpractice.
Medical
law.
malpractice.
Yeah.
And being board certified, that's your specialty.
That's correct.
And that's a designation that goes with it. Other attorneys can do it, but you specialize in it. Clint, where to start? Real quickly for our viewers, just to remind them again, the concept of medical malpractice. If someone's sitting at home, we get new viewers all the time thinking, well, wait, what did Nick mean by that? How do you know if it's something you should look into?
Right. And common talk is it's a medical mistake. That's how people typically refer to it out there. That causes a major medical injury or death. Cases like paralysis, loss of a limb, death, of course. Cases where the injury is so bad that there's going to need to be either substantial surgeries, loss of income, loss of ability to take care of a loved one. I mean, these are people that are going to have lifelong permanent injuries because there was a screw up in a hospital or a medical clinic. And
how are you supposed to know whether or not it was a standard of care? I mean, doctors aren't miracle workers. There are bad results and it's no one's fault, or that you have something. Is it a gut level feeling?
Yeah, it starts with a gut level feeling because most people have a sense in their own mind that, hey, this went wrong. I'll tell you how you normally get it. What patients tell me is the nurse looks at them funny. The explanation doesn't seem to ring true, or the doctor just avoids them altogether. And that's, of course, if it's a doctor issue. Sometimes the doctors will come right out and say it. There was a screw up, or, in some cases they'll say, hey, you need to get a lawyer. So there's kind of a hair that stands in the back of your neck that says this just isn't right. That's the layman side of it. My job is to go find a medical expert to look at the records and substantiate that there was a deviation from the standard of care. Standard of care is just the standard, the professional standard that healthcare providers must follow when they're providing care for patients.
Okay, remind folks, we always touch on this, statute of limitations.
Statute of limitations is probably the most important thing for everyone who sees this show to remember, which is you've got 1 year from the date that you discover an injury in which to serve pre-suit notice upon the potential defendant. If you go 1 day longer than a year, you got no case. And every year, Nick, I'll have a number of people. One guy came to my office a couple months ago, too late. And he had a case.
He had a case.
Yeah.
But he just waited too long.
Eye condition that was eye damage. It was mismanaged in the emergency room. A couple days later, he got to an ophthalmologist. The guy's lost his vision. Ophthalmologist said this thing was completely botched. But the guy just waited. And a lot of times the reason they wait is, first of all, they don't want to sue.
Right.
Understandable for a lot of different reasons. But he just kept thinking he was going to get better.
And sometimes the doctors will say, give it time.
Yeah. Now, in this instance, it wasn't that. It was just he really thought he was going to get better, and he planed out after about a year, waited a little bit longer after that, actually waited 18 months, and then came to see me, and I had to tell him, I can't bring a case for you because the law says that you waited too late. It's a painful conversation, Nick.
If you feel that way, that it may get better, but you have your doubts, it's okay then to come to you and say, look, Clint, I want to give this time to get better, but I suspect it's something. You talk about getting on the record for it. So if he comes to you 6 months in, he goes, Clint, I still want to give it time before we sue anyone, but can I come to you now to cover me for statute of limitations if it doesn't get better?
Sure. It's a free consultation. The phone call's free. I mean, you can call my office. I've got Michelle, who's my paralegal that handles most of the phone calls.
Yeah,
By the
she's
way,
great.
we've got a new assistant intern in our office named Carr Valentine. Hey, Carr.
Really? That's very cool.
Yeah, and he's excited about it because he's interested in this area of law as well. But we have an ability to take information from a potential client, evaluate it, and then I can make a decision whether the case has merit. If it does, I'm going to get the client in, whether we do it by Zoom or do it at the office. And if I take the case, I mean, the client pays nothing.
Right. We
I
gotta make it
finance
clear
the
on
entire
that.
lawsuit.
Right.
If I don't win any money, the client's not out anything. But the bottom line is, make the call, get the opinion. It's free, and then you know. Right. Because peace of mind is so important in these situations.
And keep in mind too, as you just said, they don't pay anything, so there's no reason not to look into it. Okay, there's nothing out of your pocket. The only thing you costs you is some time to make the call and meet with Clint. But you can't always take cases even if they're actionable because it costs you a lot of money to prosecute, or not to prosecute, to pursue it, right? I mean, there are cases sometimes where, yeah, there was wrong here, but there's not enough damage.
Yeah, medical experts or nursing experts can charge anywhere between $250 an hour to $1,000 an hour.
Wow. What's the most you've paid for an expert?
$1,500 an hour.
What is this, some kind of
per hour
surgeon
for a
or
deposition?
something?
Yeah, neurosurgeon. And these are guys that make a lot of money, Nick. So when they take time off to evaluate a case and testify, they are giving up some time at their practice, and so that's a reasonable rate considering what they make. It seems unreasonable to people who make $25 or $30 an hour, but these guys go to school for 12, 14 years before they really start turning a buck. So there is a reason for this. But the bottom line is these doctors can charge you $25,000, $30,000 just in their participation in the case before you ever get to the courtroom. And that's just one expert. Usually my cases have 2, 3, sometimes 5 experts. And so I've in some situations generated a bill of $75,000, $100,000 before I was able to settle the case.
Wow.
Now, it's a worthy investment if the damages are $1 million. Or $2 million, or a case I settled not too long ago for $3.5 million. Every dollar I put into that case was worth it because it's generating a large settlement. Right. But what do you do with the patient who only has a $50,000 damage figure?
And if you have to have experts, it's going to eat through that real quick.
In other words, when the potential damages exceed what the expert will charge and what my litigation costs are, I can't do it. It's upside down, and we don't have a system right now. Until medical malpractice is treated like workers' comp, where you don't have to prove fault, you merely have to prove causation. This is going to be the situation where the only kind of cases I'm going to be able to take are substantial damages cases.
And I always wonder about you getting your experts, and I think you have various experts for some of the more common types of malpractice cases that you have raised. You know them. Right. Established experts. But is there a fraternity among doctors where they're not always willing to testify against another doctor? You just wonder about that sometimes. Does that really not exist?
Not against another doctor. Now, there are obviously a lot of doctors in Tennessee who will not consider testifying against another doctor in Tennessee under any circumstances. It's just
simply,
well, first of all, they might run into them at a professional meeting, or they might end up, seeing them at a function. It's just there's something about when you testify against a doctor from another state, you're never going to see that doctor. You're never going to hear about that doctor. But in your own state, it's kind of like testifying against your neighbor.
Oh, so what you're telling me is a lot of the experts that you deal with come from out of state to do this?
All of them.
I didn't know that.
Yeah, I shouldn't say all. 95% of them will come from out of state.
Because in state they won't do this. Even though you would think doctors with the Hippocratic Oath, if they actually see something that you bring to them where it was an obvious case where someone was just done a horrible job, they would want to say, we got to get this guy out of the business.
Yeah, think about it though, Nick. Seriously, like, would you want to testify against your neighbor? I think that's how a lot of doctors feel.
If you look at it that way, you wouldn't want to, of course not.
But when you're from another state, when the defendant's from another state, then the Tennessee expert doesn't feel that way. Same like when I go get an expert from Kentucky, which that's one of 8 states I'll get an expert from to testify against a Tennessee doctor or Tennessee nurse. They don't have that same feeling.
Gotcha. Before we take our first break, and I want to talk about a situation with a doctor out of Florida that you and I have talked about in the past. We have Donald. We may not have the best connection. We'll see if we can hear Donald. But are you there, Donald?
Yeah.
What can we do for you, sir?
I'm just talking to someone about a malpractice case.
What happened to you? Yeah.
At this place called TOA. The doctor gave me a shot on my knee, and he got my knee messed up. I could barely talk, I could barely walk on it, and I'm swollen up real bad, and it's been like that ever since it's been this year.
Okay. All right, so I wasn't able to,
Well, I think what he said was that the doctor,
TOA,
Tennessee
yeah.
Orthopedic Alliance.
Okay, I wasn't sure which
it's
one.
the largest orthopedic group in the state of Tennessee.
And what's TOA?
Tennessee Orthopedic Alliance.
I'm sorry.
Yeah,
Okay, and he's saying that an injection in the knee. And
apparently had some knee issue, had an injection, and it messed up his knee. And of course, we don't know enough about that, whether he can get some degree of help from another doctor. I mean, it's just too little information to know whether or not he has a case. I will say this, Nick, when it comes to orthopedic injuries, in particular knees, there's a lot of latitude there in terms of what the doctor can do. That's a place where, unless the patient's going to lose a leg, most of the knee replacements, cases like that, I just don't take them because the people generally make some recovery. So it's hard to put a damage figure big enough to justify the case.
Right.
Of course, I have had a case before where patients had an amputation below the knee or above the knee, and that can lead to millions of dollars in lifelong medical expenses, prosthetic expenses, loss of earnings and income. So that's an example where the kind of case I would take, where someone has a shot in the knee and just has some pain or some difficulty, that's probably not a case I can take.
Yeah, probably not. And plus, now, we've talked about this before, it's very common surgeries, joint replacements. Okay,
Yes.
Knee replacement, hip replacements. There's a lot of factors. You've said before, look, they're really hard to say if there was something that went wrong, if it's really the fault of the place.
Because they're mostly fixable, Dick, to a large extent.
Yeah, they do well.
And you lose a limb, that's a whole different matter,
Right.
but most of them are fixable.
Yeah, and so when you say fixable, that means what are the damages?
Yeah.
Listen, we'll take a break. When we come back, we can take more phone calls, 737-7587. Questions or comments about malpractice cases, various conditions. We'll talk to Clint about what are some of the more common cases and about some of the issues involving physicians.
The orthopedic in Florida, we can talk about that.
That's scary, man. Yeah. We'll talk about that when we come back right after this with our guest.